Hey guys, like Charlie Weir, coming to you. Um, s- Today's subject is really it's not about giving tips and things of that sort. Is really just me just making statements right now because today's one was one of those kind of emotional days for me. I'm here in the office. Now I'll tell you the reason why. Um, had several follow-ups with either sickle cell patients or chronic pain patients, mostly sickle cell. One had another other rare, very rare red blood cell disorder as well. And talking to the caregivers, the moms, the dads, the aunts, the uncles, the grandparents as well, was a very humbling experience for me today. And I'll tell you the reason why. Like the first case I had, a patient I've had for a long time, and the patient, as she got older, she's now an adult, and now she started to really abuse her pain medication. She, refused to do anything that we were asking her to do because now she's grown. So now she's learned to abuse the pain medication. So looking at it from her mom's standpoint, her parents' standpoint, what was going on is her mom just basically wanted to kick her out the house. So the stress level was definitely there. So that didn't help, the patient, and it helped the parent. So today I played more of a counselor than physician, and it was real taxing, on the entire situation. Had another, one actually just left the office maybe less than an hour ago. That at one point she wanted to commit suicide. Meaning the mom. Sorry about that, guys. I didn't put my thing on airplane mode, so I was able to get. Yeah, sorry about that, guys. It was crazy technology. Got weird phone calls, and I truly apologize about that because again, I'm trying to reach out to the caregivers, especially talking about one of the moms wanting to actually commit suicide because again she's blaming herself for everything her child is going through. And like I said, it was a very emotional day. What I want to say to you guys realistically is, one reason why we create these groups is not to sort of, vent or just, whatever. Is really trying to bring a community together and help you guys with different things of this sort. Whether it be truly trying to talk to someone, reaching out to someone who really wants to listen to you and not just be felonious or just hang out. Because as most of you guys know, that's in this group that deal with chronic pain or chronic conditions is very emotional. Whether you're a patient or you're a caregiver, you know that your emotions are on a constant roller coaster. You're always anxious about something. So I just want to let you guys know that from a physician standpoint who treats this stuff on a daily basis, sometimes yes it gets taxing on me, especially in a day like today when I hear two or three groups of individuals, different groups at different times in my office, sort of having the same types of conversations, and it's really kind of scary that there's not much more support out there for you guys, other than social media platforms that you can vent, but you can't really get that one-on-one, face-to-face. So I would implore you guys to continue to seek out help amongst your own community, and also be vocal with each other. Meaning, if your patient is doing something or is evoking certain emotions that's really affecting everyone around you, have those heart to heart conversations, about self care or whatever it is that's going to allow you to have a more cohesive family or communication with that person as well. I tend to give tough love inside my office because I know what happens when someone fails to do their part. If I ask you to drink water, on a daily basis and you're not drinking water, yes, I get pretty tough on my patients because I know the consequences. But at some point, is also you have to be emotional and be personable with people too. And a lot of times, I've heard of cases where some parents, every time the child, teenager would go into a suicide crisis, they would seriously drop them off at the hospital and say, "Oh, call me when it's time for me to pick you up." I don't even see the child one day in the hospital because well I'm too busy. I still got to earn a living. Yeah, and sometimes things like that happen. But what I'm saying is we have to be more compassionate towards each other, knowing that at any minute something tragic can happen. So we have to find those outlets. It's one reason why I did a whole series on stress and stress management and what stress can really do to your body, to try to not per se give you a scare tactic, but just give you things that you guys can do on a daily basis to alleviate stress, like going for those walks, spending that personal time to yourself. In fact, I was just having a conversation with the mom who was, contemplating suicide. This was years ago, but the fact that she admitted to me in private that she actually contemplated suicide, I said, spend time with your hair done, even or if you go get your nails done, go see a movie, do something just for you on a daily basis. You have to make sure you're de-stressing yourself so it can be good for the entire environment. Thus, also you got to empower the patient as well by making sure that they're being proactive in their own care too, and they're not running to you for everything. So that's why we're also doing these trainings too. It's helping you to care for each other, and it's a whole cyclical thing. Again, I always say I go off the questions that I do my videos off of, but today it was more so just all clinical. What I was seeing in my clinic today was just so emotional. But again, learn how to de-stress yourself, learn how to talk to each other and not yell, and be very personable to each other. I know a few of you that are on the line right now, or on the video, excuse me, on the line. You have great relationships with your children or your spouses because of the fact that you learn how to communicate, because we had those conversations, and I appreciate that, and I wish there was some sort of way we can actually expand it out to this entire community, especially the sickle cell community, because again, historically, we are not talkative individuals. We're trying to solve problems over and over again, or prevent problems, but we also got to learn how to communicate and also empower each other. So the more we can connect like that, please, let's figure out a way we can actually connect, on that level again. And again, like I always say, I'm just trying to give you guys information. And like I said, today was just an emotional day for me because I'm dealing with, not just the patient, but also the caregivers today. So I just want to tell you guys, you have support, build those support systems, figure out a way that you can actually, bring each other closer together, and just keep loving each other over and over and again, over and over and again, in a genuine way. I'm not just saying, just say I love you, but just show it in more of a prolific way as well. So as always, guys, I'll sign off by saying I love you, God loves you, and take care, guys. Thank you so much. I really appreciate it. I appreciate that, Ms. Carter. I'm trying to do my best. That's all I can do. Is just keep it going. What I do on a daily basis, whether it be with a patient, research or whatever, is all geared to making sure I'm uplifting this community that doesn't have a lot of foundational things. A lot of people just fall through the cracks. And when I see what happened today in my office, some people who fell through the cracks, I feel personally responsible for it, even though I know it's not my responsibility. But I still feel personally responsible for it, because if I'm out here trying to advocate for this community, I want to make sure that everyone is touched by it. And thank you, Ms. Forrest. I love and appreciate all you guys, and you girls still rock, over and over again. So hopefully I'll see you guys soon, because I have some things I want to talk to you about as well. So let's stay in communication, guys, and I'll talk to you guys soon.